All right, we got slides up and running. Welcome, everybody. My name is Matt Drake. I'm a pulmonologist and critical care intensivist out here at Oregon Health and Science University in Portland. We are really excited to have you here today. So on behalf of the ATS, this is our kickoff of the 2022 Resident Boot Camp. Now, you guys are part of a tradition here. This is the 8th year that we've actually been running this boot camp, and it's evolved a lot in the last 8 years. This virtual component is really something we started to build in the last couple of years as we've all gotten accustomed to. We're very excited to be back in person this year at ATS. I know many of you are going to be attending in person for the Resident Boot Camp. I do hope that all of you are considering attending the international conference in San Francisco. It's going to be great to be back in person. Without further ado, I'm going to turn the reins over to Dr. Mata here, who is going to introduce our speakers and our facilitators. We really have an outstanding lineup of folks to launch into this really important topic in our field. So welcome, and over to you, Dr. Mata.
Thank you, Matt. My name is Maroon Mata. I'm also a pulmonary critical care physician. I'm at University Hospitals and Case Western in Cleveland. And I want to echo what Matt said. Welcome, everybody, and we're looking forward to having you. This is not a replacement of the in-person ATS bootcamp. This is actually an addition, and hopefully it would make your in-person experience even more beneficial for you when you get there. I'm going to kindly ask the people who don't want to speak or have a comment to go on mute just to avoid the feedback that is coming back. So we're really excited to have you here today. This is going to be our mechanical ventilation resident bootcamp, the virtual aspect for it. And we're very lucky to have an amazing group of educator and instructors today. They're led by Dr. Ren Ashton. He is the Fellowship Program Director for Pulmonary Critical Care Medicine at Cleveland Clinic, and Dr. Neil Chasen, who's the Fellowship Director for Critical Care Medicine at Cleveland Clinic as well, and with a great group of instructors that will be going over cases as well. The way we're going to structure this, it will start with a brief slide introduction on mechanical ventilation that Dr. Ashton will walk us through, and then we will divide into groups, into small group sessions. We have 2 cases that we would go through with about 20 minutes each, and at the end, everybody will come out to the breakout room for a few words, and then we'll wish everybody farewell after that. This is one of our 2 virtual boot camps. The next one is Introduction to Bronchoscopy, and that will happen Monday, April 25th. So if you haven't had the chance to register yet, please do so. I think it's gonna be great as well. So without further ado, without more wasting time, I'm gonna pass it to Dr. Ashton to talk to us about. And yes, before I forget, also to have a slide from me, I still forgot. We have a wikithoracic.org with all the material from the boot camp that is also available for review whenever you have it. That's all I wanted to say, and I'll pass it to Dr. Ashton.
All right, thank you, Dr. Mata, and welcome everyone to our virtual session. This is the first time we've done this as sort of a split session. Neil and I have been doing this part of the course for a number of years, and of course, because of COVID, we've gone virtual in the last couple of years, but we're going to be happy to be back twirling the knobs on the ventilators at ATS this year, but we thought it would be great to continue with the virtual aspect of this as well, as kind of a 1-2 punch, and hopefully it'll be the most effective everywhere ever this way. So I am sharing my screen here. Is everybody seeing my intro slide here? Okay, awesome. So we are going to. This is just a QR code. If anybody wants to scan this will take you right to the wiki site, same as the URL that you saw a minute ago. If anybody doesn't have the primer, the little handout that we prepared and have sent out to you, this site will be a way for you to access that, as well as all the other information that has to do with the bootcamp course. So anybody who wants to scan that, this is your chance. And then,
hey, Ren. One quick thing, despite our efforts, I realized that Mamoon put up the username and password that's for the residents. And so the username is resident, and the password I think is ATS camp. Matt or Maroon, tell me if that's
correct.
wrong.
That's correct. I'll post the new one in the chat.
Okay, great.
We'll type it up in the chat. That is correct.
all right.
Sorry.
First disaster handled. Okay. So let's just go down some assumptions for the day here. We are here as learners, all of us, and we want this to be a safe space to learn. So nobody's going to make fun. Nobody's going to assume that, you should know something, or, this is just, it's a place for us to ask questions and learn anything that we want to find out from each other as we study mechanical ventilation. So don't be worried about wrong answers. If you think something and ask a question or say something and it's wrong, probably many other people thought the same thing, and now you all know more than you did. So don't feel bad about that. Also, we've gotten used to the virtual platforms, and hopefully we all know how to interact in an online space. Please do interact. Please engage with us, ask questions, and volunteer your thoughts. We may call on you. That's not a threat. We're not mean people. We're not picking on you. We really want this to be a two-way conversation and a learning experience. So, if we do say, hey, what do you think? Just tell us what you think, and we'll go around the circle. Remember that most people on the call have no idea who you are, never going to see you again. So the stakes are low, but the more you participate, the more you'll learn. And it's also okay to offer something if we don't call on you, and that's great too. So let's go through just some basic principles. This is just kind of one quick perspective, just to kind of get some juices flowing. This is not meant to be a comprehensive introduction to mechanical ventilation. There are many, many books written on this, as you know. So we're just going to try to give you some useful brass tacks type of information today. So let's just jump right in and talk just a little bit about some principles that are going to help you make sense out of ventilators and ventilator modes. Now, one of the first things that you need to understand as you are approaching a ventilator and trying to figure out what's going on with it, what mode is being used, and how it works, is the concept of control variables. All right. And the way I like to explain this is a little bit odd, but I like to imagine that there's a monkey inside the machine. Okay. And this is not just any monkey. This is a union monkey. Okay. The monkey's not going to do anything if it's not his job. Okay. And so you have to tell the monkey what the job is that you want the monkey to do. And then you have to worry about anything that isn't the monkey's job. All right. So the control variable is a parameter of the mode that you're going to assign to the monkey to worry about. All right. And that's either going to be volume together with flow, or it's going to be pressure. Okay. But the monkey knows it's not his job to worry about both of those, either volume or pressure. You take your pick, but you have to worry about the other one. Now, this is I think the only equation that we're going to give you here, and you can memorize this or not, up to you, but this is a really, really useful concept. All right. We're not going to be doing any fancy math here. We just want you to understand these concepts as they pertain to ventilation and pulmonary physiology here. And so the idea of the equation of motion, and this will feel like a throwback to your high school or college physics when you studied electricity. You remember voltage and current and resistance. Okay. And then when you learn fluid dynamics, you realize that it's the same equation, only with pressure and flow and resistance. That's what we're looking at here. So the pressure in the ventilator, or you can think of this as the overall airway pressure, is equal to the sum of the elastic pressure in the system and the resistive pressure in the system. Okay. And if we break those down, then the ventilator pressure, or the airway pressure, is equal to the elastance of the system. And when I say the system, I mean the lungs and the chest wall, right? So how well do they expand, and the elasticity of wanting to resume their original size, times the volume of air that you push into that system. That elastance and the volume you push into it are going to combine to create a pressure, and that's the elastic pressure of the system. Then the other piece of this is the resistance flow component. You remember from fluid dynamics that anytime you push a fluid through a tube, there's a certain amount of resistance, and that has to do with how long the tube is and the diameter of the tube and the viscosity and everything else. That's the resistance characteristic of the tube, okay? And then the flow that goes through that tube, when you multiply those two together, you get another pressure, and that's the resistive pressure. So when you add the elastic pressure and the resistive pressure, you get the overall airway pressure. This is worth remembering, all right, because it's going to help you understand these control variables. Remember that the monkey's only going to care about either volume and flow or pressure, but not both. So you're going to have to worry about one side or the other of this equation, okay? All right, so let's do that. So if the monkey does the pressure, then the control variable of the mode you're using is pressure. That would be a pressure control mode in a sort of generic sense. And you will set your alarms to tell you when the volumes or flows are not what you want, because that's your job to worry about volume and flow. If the monkey's doing volume and flow, then the control variable is volume, and that's a volume control mode in the generic sense. And you'll set your alarms to tell you when the pressures are too high so that you can worry about the part of it that is your job. Now we are all familiar with the respiratory cycle, inspiration, expiration. When we talk about ventilation, the event that starts inspiration is called a trigger. That's what triggers a new breath. And there are different variables or different things that can trigger a new breath depending on the mode you're using. Sometimes breaths are triggered by time. If it's just been too much, if there's been enough time since the last breath and it's time for another breath, and so the machine initiates a breath, that's a time-triggered breath. If the patient wants a breath, they can make an effort, try to suck a little bit on their ET tube, pull in some flow or drop the pressure in their circuit, and either that inward flow or that drop in pressure can also trigger an inspiration on the ventilator, okay? So those are our main types of triggering events, and those will also help us as we're thinking about different modes and how breaths are initiated. At the end of inspiration, there's an event that ends it and turns the machine to expiration, and we call that cycling the breath. So what's happening at the end of inspiration to end that the inspiratory phase and go into exhalation? That again can be time. That can be reaching a target volume, or it can be reaching a preset flow level that will usually be a percentage of the peak flow level. And those are the ways that different modes cycle the breath and enter the expiratory phase. There's not going to be a big quiz on all this at the end, but these again are things that you're going to want to know as you start getting your hands on ventilators and thinking about which modes to use, and you'll want to have straight in your mind what are the triggers and what are the cycling events for the mode that you're using. Okay, let's talk about another feature of ventilator modes, and that is different types of breaths on the ventilator. One type, and there's only 3 types here, okay? We're into short lists, just short lists, okay? So there's 3 types of breaths. There's mandatory breaths. Mandatory breaths are either triggered or cycled or both by the machine, okay? If the machine is doing either the triggering or the cycling, it's a mandatory breath, all right? Then there's spontaneous breaths. Spontaneous breaths have to be triggered and cycled, not one or the other, but both by the patient, okay? So those are the only types of breaths. I think I said there were 3. There's only 2. There are 3 breath sequences, all right? There's continuous mandatory ventilation, where all the breaths are mandatory. Okay, so remember, that means that every single breath is either triggered or cycled by the machine, or potentially both. There's intermittent mandatory ventilation, where some breaths are mandatory and some are spontaneous. And there's continuous spontaneous ventilation, where all the breaths are spontaneous. So the patient is both initiating and cycling off of inspiration. Now, there's one other aspect of modes that we're not going to get into. We got to leave something for you to learn during fellowship, right? So the other aspect of ventilator modes is a thing called targeting schemes. And this is where modes get really cool, especially when you get into the fancier modes that interact with patients and respond and adapt to their effort and different things like that. We're not going to get into those modes today. We're going to be talking about the bread and butter modes that you can use day in or day out. And the better you know these fundamental modes, the more the fancier modes later will make sense to you. All right, let's get into just a little bit of knobology. So when you walk up to a ventilator that you've never met before, all right, this is these are some of the things that should just go through your mind And as you go through this short list and kind of familiarize yourself with this new ventilator, you're going to be in a position to interact with this ventilator in a meaningful way and actually use it to care for your patients, okay? So the first thing you do, you walk up to the ventilator and you need to figure out, okay, which numbers on this screen are my input values, right? Which are the numbers that I had to put in to tell this machine, the monkey inside, what parameters I want this mode to follow, okay? And I've just put up 3 different examples of different ventilators. These are common ventilators. This is the trusty old PB840 that's kind of phasing out. It's getting to be kind of a relic here. The Maquette Servo I, this is also a good workhorse ventilation, and the CareFusion Avia. We don't have these here, but we've actually seen them at the boot camp in years past. I don't know yet what vents we're going to have, but I guarantee it, whichever vents we have, these steps will work. Okay, we're going to go up and figure out where the input areas are. So for these 3 ventilator models, okay, look inside these red boxes, and you can see that in each of these examples, the input values tend to be at the bottom of the screen. Don't take that as a rule, but they're going to be somewhere near where the knobs are or the buttons are that you're going to interact with, okay? As opposed to the output areas. Where do you look on the screen for the data that are reflecting the interaction between the ventilator and your patient, okay? And those are going to be where you see the yellow boxes here. Remember that waveforms are always feedback, right? Those are always going to be data that the vent is feeding back to you about that patient-ventilator interaction. And usually the numbers that go next to those waveforms or that are color-coded with those waveforms are probably feedback values. So you can look at those and very quickly make sense. Okay, those are feedback numbers that I should be paying attention to, especially once I realize, which part of the equation I'm responsible for. Okay, then you need to figure out if I want to change something with the mode that I'm using, how do I do that? All right, and so you would study the buttons and knobs on the machine. And a lot of the modern vents have fewer and fewer buttons and knobs and mostly have touch screens, right? And we're pretty comfortable with that. Even old people like me, we're getting used to touch screens. And so a lot of times when you see a value and you want to change that value, you just touch the value and then twirl the knob to the new value that you want, and then either hit enter or accept, or sometimes you just push the knob itself or touch the value on the screen again, and that will save it, and the ventilator will start using that new volume or that new flow rate or that new timing or something else. And so it's usually pretty easy to change the input variables that you are using with the mode. We're going to learn a little bit today about the display waveforms and which ones are most useful. Most of modern ventilators will show you 3 waveform tracks now, or channels: pressure, flow, and volume. If you've got a machine like the old PB840 that only shows you 2 at a time, usually volume is the one you can leave out. It's rarely very helpful unless you have a big air leak or something. But pressure and flow are especially helpful. And we're going to, as we go through our cases, you'll see how we use these waveforms to understand what's going on in the interaction with the ventilator and the patient. And then the last thing that you want to figure out with this new ventilator that you're meeting for the first time is, how do I perform the maneuvers that are going to help me gather information I need to know about the situation, especially how to do an inspiratory and expiratory hold. So if you're trying to figure out what the plateau pressure is or what the auto PEEP is, then you're likely to want to do one of these holds, and figuring out how to do that with your particular ventilator is going to be an important thing to work out. Okay, so there's our control knobs in orange, and that is it. That's all the introduction we felt you needed. Hope you're feeling prepared to go into some cases now. So what's going to happen is we're going to break out into breakout rooms. Each room will have one of the instructors and then a group of participants in the room. And half of the instructors are going to do one case. The other half are going to do another case. And then after 20 minutes of working through that case, the instructors will all switch, and everybody will have a chance to do the second case. Okay, so we want to keep this moving. We do want it to be interactive. Please remember to ask questions and make comments and interact with your instructors. But also remember that we just have 20 minutes per case. So that's how we'll go for the next little bit. Anything to add? Any questions before we go into breakouts?
This sounds good. I'll be sending everybody to the breakout room soon. Once again, if you guys have any trouble in the big breakout rooms, pop on out to the main lobby. I'll be waiting out here if any issues arise. And instructors, I'll give you a heads up with about a minute to go in 20 minutes that I'm going to switch you in the rooms. All right, we'll see you soon.